So our research is on ST131 E. coli, specifically in UTIs. So we're interested in ST131 because it's found to be associated with a lot of resistance, specifically like fluoroquinolone resistance. So that's why we're specifically interested in this sequence type of E. coli.
So we used two isolate sets, one collected from patients in Boston, Massachusetts, and one collected from patients in Minneapolis, Minnesota. And these two isolate sets were collected from roughly the same time period in 2013 and 2014. And so we were collaborating with Jim Johnson, who's an ST131 expert. And when we compared the two isolate sets,
yeah, we found that overall their phylogenetic distribution was pretty similar. We looked at their resistance genes profiles; they were pretty similar. One key finding was that the CTXM27 was found uniquely in the Boston isolates, so none in the Minneapolis set. And also the ESBL prevalence was slightly greater in the Boston isolate set than the Minneapolis set. So that's been a new finding. The CTXM27 has been found in Japan, in Europe, but we've found it now in the United States clinical isolates.
So we're not sure entirely what accounts for the difference between the two cities, but we hypothesize that with Boston being on the coast, that there may be more international patients who are seen at the hospital where the isolates were collected, as opposed to patients seen in Minneapolis, maybe from more rural settings in the Midwest of the United States. However, we're not exactly sure what accounts for the difference.
And those were also, since those isolates were from 2013 and 2014, it's possible that now there might be some of that CTXM27 in Minneapolis as well. Now we're interested in some of the clinical outcomes associated with this ST131, specifically the H30, possibly the CTXM or the C1M27 clade infections as well. So we'd like to do some studies to see if the ST131 H30 is associated with worse clinical outcomes, if it's also associated with increased resistance.
And we're also interested in doing a comparison of a more contemporaneous isolate set, so collecting more isolates from Minneapolis to see if there have been changes from what we saw in the 2013 isolate set. So that's something else that we plan to collect more isolates and see if those have changed over time.